tattoos, and I've said several sessions for, there's 3 tattoos. 2 of them will need, I think I said 3 sessions, and one of them would need possibly 1 session. And they said this one is the main one, and they're worried, not worried, they want to get it all out in one go, and they live far away and they don't want to come all the way and find out that we can't remove it in 1 session. So can I tell them whether I can remove it in 1 session if they send me videos and photos and things like that? If they can they do more for me to tell them? And the answer is no. You can't do more. We can do Skype consultations. You can pick, because she's saying I can pinch it. It's up here. It's up here. I can pinch it and it pinches well and all that. And the reason we can't do more, number one, it is really. I mean, I do enjoy answering questions. You probably noticed that, and I do like answering questions. Things like that, and I'll do my best to ask questions. But you cannot guarantee. I mean, you cannot not guarantee. What's the word? Beat. Another word for beat. You cannot. Well, I'm just going to use beat. You cannot beat an in-person consultation. So you can't beat an in-person consultation. Maybe beat is the word. Maybe there isn't a word. Because, well, first of all, you can't beat an in-person consultation. When you see the person, you can actually feel the tissues yourself, and all that sort of thing. But even if you send us a video of you pinching and all that sort of stuff, what we do when we do the surgery, you know, same with tummy tucks and any sort of surgery, what we do is we make 1 cut. So this is a tattoo here. Make 1 cut and then stretch the skin during the surgery. It's called tailor tacking, seeing how much skin will be able to excise, and only excising it when we know we can close it. So to be honest with you, even if you come to clinic, I guess we'll be able to give you a bit of a better idea when you come to clinic. But even then, sometimes I'll be like, I don't know if I can get all of this. I can't guarantee I can get it all out, because if it's really tight closure, I might have to leave a little bit on either side of the ink. A little bit of ink on either side of the scar. That's even, you know, in surgery, we don't know exactly how much we can take out. It's the same when you're doing a tummy tuck. When you mark people, you mark the top line, but you don't cut the top line. You cut the bottom line, you undermine and you stretch it as much as you can. And then you take out the top incision when you've seen how much you can take out, if that makes sense. Maybe I'm confusing it going on tummy tuck. But basically with a tattoo, we cut out one side, undermine it, pull it across and see how much we can take out and tailor tack it, because we don't want to take out too much and not be able to close it, because that would be a disaster. So we can't guarantee that we'll be able to get it all out before you come to clinic. In fact, we can't guarantee it before you come to the surgery, to be honest with you. You might have a bit of ink on either side of the scar. So it's a tricky one. And I'm sorry, if you live far, it's tricky. You might not, and the best is to say, look, you might still be, now you might be okay with that, because it'll be a scar with a bit of ink on either side. It won't be recognizable as the tattoo. It'll just have a bit of ink on either side. But don't want you to be cheesed off if that happens. So I'm telling you now, you might have a bit of ink on either side of the scar, and if that's going to cheese you off, don't have it done, because it might need 2 goes. It's really hard. It's really hard to say it won't need 2 goes, because the worst thing we do is we either can't close it, or we close it really tight and then it opens up, and then so we will do our best to get the most out, but we can't guarantee it without seeing you in person. So the idea, yes, you can get an idea of whether your tattoo can be removed without coming to the clinic by sending us a photo. But as I say, this particular patient has sent us photos, and I've said, look, I think it might be coming out in 1 go, but possibly 2, and I can't really go more on that without actually not only seeing you, but actually, as I say, often doing it. We try and make it as tight as we possibly can.